Is there anything special we're going to talk about?
We're going to talk about you.
Me?
Yeah. My name's Charles Moon. I am Director of Orthopedic Trauma at Sacral Medical Center in Los Angeles. We see a large geriatric patient population and a large number of pelvic insufficiency fractures. While we have used traditional large bore cannulated screws for quite a while, it hasn't been completely satisfactory, and because they aren't really designed for this clinical problem. SI-BONE offered a device actually made for this population, or made for this clinical problem specifically. I began to be very interested and started looking into this.
I'm Pauline Romano, and I'm 94 years old. It's my birthday today.
My name is Janet Morris, and I'm Pauline Romano's daughter. And unfortunately, my mother had a fracture. She fell in August of 2021 and fractured her pelvis and sacral area, and it was found to be a non-displaced fracture. And then they didn't want to do surgery at that time, I guess because of her age and what they saw with the fracture. And at first she went to a rehab center and got more mobility, came home and started getting worse, meaning she was in a lot of pain. Eventually she couldn't really walk anymore, and that's not the kind of life she wanted to live. So it was, I think, very depressing for her, and she was losing, her willingness to, go on at that point.
Pauline presented our clinic in September of last year. By the time I saw her in the office, she was wheelchair bound and pretty miserable. We were able to get CT, which did show that she wasn't really showing any fracture healing. So the plan for her was transiliac implant placement at S2 corridor, and then a TORQ implant at the S1 corridor to compress, but also fill up and reinforce that S1 corridor.
Yeah, can you believe it? This is what Dr. Moon put in you.
This one?
Yeah, that's a new device.
She did very, very well postoperatively. Actually got out of bed for the first time in quite a while, almost immediately.
It was actually no pain. Very little pain, if I remember correctly.
You did physical therapy, occupational therapy.
Yeah. It's very good. They make you feel like you're really going to get through it. It's fine. And you do. And you do get through it. I mean, it was hard to walk, it was hard to do this, it was at times, but that's the way it goes until you get better.
When my mom was in a lot of pain, she really just wanted to be in bed. She didn't want to do anything. It was very hard for her to move. It was very painful for her to move. She eventually did get better, and one day there was no pain. And now she has no pain. But with follow-ups with Dr. Moon, he sees that she's recovering great and her functional status
Everything
is
went
better.
very smoothly.
And now she's better than she was before. So she's fully functional on both knees. She's fully functional in her hip. She can walk, she can get up, she can go to the bathroom.
Comparing her now to the person that I first saw, it's two different people. Pauline, can you just stand up and down one more time?
Yeah.